So I think there's a number of trends in molecular imaging for immunotherapy response. And actually imaging the immune system is something that's relatively new to the nuclear medicine community. Up until recently, we didn't really have any tools that were specific for immune cells. So one of the first probes was a CD8 probe to image CD8 positive T cells. And that's in a phase 2 clinical trial. And so some of the participants heard about that today, and I think there's a lot of excitement about it. But what we learned more is that there's even more immune-specific tracers that are being developed, a variety of other immune markers, CD4, and as well there's excitement about imaging immune activation. So starting to think about not just are the immune cells present, but what are they doing? Are they activated? Are they actively killing tumor cells? And we heard a great overview of all the different approaches that are being developed in molecular imaging to image immune activation. And I think there's a lot of excitement about that. I think the attendees will hopefully come away with a few different nuggets of information. I think obviously one is just the enthusiasm for imaging in the setting of immunotherapy and some of the philosophical approaches as to why we would want to image early. I think as an imaging community we often assume that of course we would want to image early, but I think on the receiving end, on the oncology side, it's not always as obvious. And so I think we stepped through some nice approaches for why one would want to image early, which would include being able to guide clinical management, understand the mechanism of response, and potentially even use these tools in the setting of new immunotherapies. And so I think the hope is that some of these are going to become available in the clinical space very soon. So hopefully the attendees will learn a bit from all of that.